Hi, everybody. Welcome back to another edition of Business Matters, the Broomfield Chamber of Commerce video podcast. We appreciate you being with us today. My name is Pat Monticelli. I'm your host today. And as we go through today's topic, at some point we would love it if you would hit that like button and also subscribe to the Broomfield Chamber of Commerce YouTube channel so we can keep bringing you this great content. We've got a really good topic for you today. We're talking about health insurance. And as we know, health insurance can be cost prohibitive, especially for small business owners. It oftentimes leaves them in a position where they're not able to help out their employees with health insurance or health coverage or reimbursement or anything like that. We have a solution for you, and we're going to talk about that with Chip Murphy from Kelmeg and Associates. Chip, thanks for being here today.
Pat, thanks for inviting me out here. Appreciate it.
So we want to talk about this issue because, as we said, health insurance is very expensive, and for some small business owners, it's just too expensive to offer anything to their employees. But there is a solution. Let's kind of hit the 30,000-foot level of what's out there for folks.
Sure. Pat, when insurance in the last 10 years has really skyrocketed, and we're seeing increases pretty much every year. Fortunately, the last couple of years has been only about 4, 5, 6%, but prior to that was 10, 20, 30%. So things have really gone up in price, and that has really affected the small business market, especially the employees. Companies can't afford to offer their employees in some cases. Other times they're pushing on a lot more of the cost nowadays onto the employee. So what has happened in 2020, the federal government has designed a new type of plan called an ICRA, and it's an acronym for an Individual Coverage Health Reimbursement Arrangement. It's part of the new HRAs that have come into effect in the last 5 years that have really taken the insurance marketplace by storm. So it's really helped out, and it's really helped out a lot of individuals. And actually, one of the actuarial services that's very big in the insurance business is company called Milliman, and they predict that 50% of the 50% of the businesses will be using this ICRA in some fashion in their business to be able to offer their employees benefits.
So talk us a little bit through the ICRA. What does that mean for an employer? What does that mean for an employee? And how does that type of HRA help out?
Right. The way it works, Pat, is the company decides they look at if they offer a group health plan, they look at this as maybe a replacement for their group health plan. It's much more flexible. You can offer it to a lot more people. You can offer it to a small amount of people if you want. You can designate which classes you want to offer the benefits to. The other thing is it's very flexible, as in comparison to the group plans, you offer one plan, one carrier, and one size fits all for all the employees. This way, this offers over 70 plans and over 7 carriers, maybe 8 carriers, depending what area you're in Colorado, and you can offer all these benefits. The employer, all they do is they put in the contribution amount, and that's flexible as well. How much are the employer going to help the employee pay for their health insurance? Right now, a lot of them pay 50%, a lot of them pay 75%. Some of them just pay for the employee, some of them don't pay for the employer. So it's very flexible how you can do the put in your contribution as the employer. But for the employee, they have all these different plans. They can pick Kaiser, Anthem, Cigna, Bright Health Plans, Friday Health Plans, and a few others that they can pick those benefits as compared to going. When you go to work for an employer, you have one plan, one situation.
So for an employee on their end, they're making contributions into the HRA as well, and so when they go for medical services, how does that happen? How does it help them pay for their medical services?
Well, it's flexible from that standpoint. The employer is putting in a contribution for the premium. If the employer wants to, they can even put more in towards their health care expenses. Okay? So basically what it is, it works just like a group health plan. You pick the carrier, you have Anthem Blue Cross, you go to that carrier. Whatever plan you choose, whether you want a gold, silver, bronze plan, you want a catastrophic plan, that's up to the employee. And depending on the contribution, see how much is going to come out of the employee's pocket. So it's very flexible on both areas. Some employees need a lot of medical care. They have pre-existing conditions. All pre-existing conditions are covered. So there's no holes in the plan. And they're all ACA approved. So there's no holes from that standpoint either.
It sounds like a great option. You said these are starting to roll out. Any real world feedback on how these things are working for folks?
Yeah, actually, this afternoon we're doing another one. Small company out of Boulder. They have employees in Iowa and employees here in Boulder. So they're trying to figure out how do they cover the employees out in Iowa with a group plan out of Boulder. So this way, the employee picks a plan out of Iowa. We incorporate into the ICRA. The employees in Boulder all pick local plans that they want to pick here and put it together. The employee actually pays the carrier just like they do now with the group plan. The employee is able to pay their portion with pre-tax dollars through a Section 125 that is set up for them.
So the bottom line is it sounds like a much more affordable and easily manageable program for employers and employees.
Right. So basically the employer gets a business expense just like they're taking now in the group plan. Mm-hmm. The employee gets the tax-free benefit of the contribution from the employer. They're able to pick their plan that is appropriate to their location, and it works out for everybody. And the way it works out is we have a third party that does the ICRA administration. And even today with the group plans under today's conditions in Colorado, not all states are the same, but in Colorado the individual plans are cheaper than the group plans. Okay, so you're going to realize saving money right from that point on.
Great. If there's an employer that's watching today or finds out about information about the program, how do they get started?
Yeah, how they get started is give me a call. We can talk about their particular situation. If they have part-time employees, they have full-time employees, they have management employees, depending on how their scenario is set up. And look at what they're offering now. If they're not offering anything, a lot of their employees have individual plans already in place. Those plans they're using with after-tax dollars. This is a way to save the employee money right off the bat because now they can use pre-tax dollars to pay for it. Okay, right. The employer is able to offer a benefit, and when you do offer benefits, you're offering added value to your employees. They're more likely to stay with you, and you're going to have benefits going on.
Absolutely. So go ahead and give us that phone number if somebody wants to reach out to you. Okay,
Chip Murphy with Kelmeg and Associates. My phone number is 303-466-9575, or if you want to email me is Chip, CHIP, at Kelmeg, KELMEG.com.
Great. And while I have you here, since you are a Broomfield Chamber member, I want to give you a chance to talk about Kelmeg and Associates. So give us your 30-second pitch about your organization.
Okay. We've been around quite a while. We've been in Broomfield for almost 20 years now. So we deal with the small business market. We also have an open enrollment center for Connect for Health for the individual side of it. We deal with Broomfield County, the city and county of Broomfield, and also Boulder County for an open enrollment center for those folks as well.
Fantastic. Chip, thanks again for being here today.
Thanks for asking me, Pat.
Great information. We appreciate it.
Okay.
That is all our time for today. Don't forget, please like and subscribe. Like this podcast, subscribe to our channel. We would love to see you here more often. We'll be back next time with another edition of Business Matters.